Good afternoon, everyone, and welcome to our special cardio edition of the Health Cafe. My name is Pooja Sudha. I'm a Beach Miss Universe and a motivation speaker, and I'll be your moderator today here for such an amazing event, we can say. Today, we're diving deep into the engine that keeps us all going, our heart. So, thank you so much for joining us. Whether you are here as a caregiver, a curious mind, or someone navigating your own heart journey, today is for you. Because we are not just going to understand the heart. We're here not just about the medicine, we are here about the love, life, and longevity. Thank you so much. So, who better guide us than our incredible panel experts? We have lined up our three doctors, so I will introduce them. First, we have Dr. Dhirender Singh. Thank you so much for joining us.
Thank you.
Dr. Dhirender Singh is a seasoned interventional cardiologist with over 16 years of clinical experience. He specializes in procedures such as coronary angioplasty, pacemaker, implantation, and device closures. We have the next doctor lined up, Dr. Srinivasa Rao. Thank you so much, doctor, for joining us. Dr. Srinivasa Rao is a consultant in internal medicine with over 20 years of clinical experience. Specializes in managing critical illness, metabolic syndrome, and chronic conditions like hypertension and diabetes. Last but not the least, we have our third doctor lined up with us, Dr. Gazala Shahnaz. Thank you so much, Dr. Gazala, for joining us today. She is a specialist in maternal fetal medicine with over 7 years of experience in advanced fetal care. She focuses on high-risk pregnancies and prenatal screenings. Her expertise includes fetal imaging and managing complex twin and growth-restricted pregnancies. Thank you so much. Welcome all the doctors. So are you all ready? We are excited today for this discussion and we have to just dive deep into it. We're not here for the turbulence, we are here for the transformations, of course. So we have our audience over here who's going to put up the questions, and definitely I would love my audience members also. Thank you so much for joining us, because without you it won't be possible, and definitely we need your support all the time. So we have our audience also here to ask the questions, so maybe we start with our audience member, please.
Good afternoon, doctor. I would like to ask when we need to start more on this cardiac checkup and cardiac workout. Any particular age or anything is there?
Okay. See, I would like to give this answer as, first of all, study says after 40 year of age, your risk of heart disease increases, especially in man, and women in little later, especially more after the menopause. But nowadays, the way we are saying the population is affecting so early that we say that you should at least get your basic health checkup first. So that, as I say, you get to know your number first. So sugar, cholesterol, blood pressure, and your basic ECG. And if your risk factor is high, then we can go with the echocardiogram, CT calcium score, the CT coronary angiography, depending upon the risk profile. So we should get at least annually, this should be done in a normal healthy adult, and we should not delay these things. And you should look, you ask yourself, are you eating healthy? Are you taking smoking or alcohol? Are you have a family history of heart disease? So you should not ignore these things. So if you have a family history, especially man less than 55 year of age having a heart problem, or woman less than 65 year of age having heart problem, that means you are also at a high risk. So then you should check yourself more aggressively and regularly. Go check everything with a doctor, and so that you can know where you stand and what is the next step you can take for your health.
So as the studies have said clearly, earlier it used to be like 40 years and above in a male, and a 50 years or menopause status and above in a female. But looking at the picture of the coming recent things like sedentary lifestyle, eating unwanted things like processed food, and a lot of stressful activities. So with all these things, the incidence of heart-related elements, the heart diseases, have increased significantly in the recent days. So there is no particular age limit that. So considering the history, considering our eating patterns, considering our family background, we can do the screening at earlier days, earlier part.
should I be hitting the gym for healthy lifestyle, or is disc work is enough? What you feel? Because we can see some fit people who also have some heart issues nowadays, so it's very confusing. So, what do you feel like this?
Yeah, very good question. In fact, it is. See, this coming to the exercise part, where it is the exercise or gym or whatever it is. So it's like it's important for each and every one of us. So coming to the factor that whether it is a gym or whether it is a brisk exercise, so those people who can do active exercise, suppose if you take an young adult, for example 30 to 40, 50, they can hit the gym. So but basically before hitting the gym, they make sure that they should not be having any kind of elements like heart problems or kidney problems, because after going to the gym, having some problems or troubles during the gym and again getting admitted, no, this is all like in unwanted troubles. So you should have a kind of healthy checkups. They can have a health checkups. So before going to the gym, suppose if somebody is planning to go to the gym, get in health checkup, and they need to know the heart condition, the kidney condition, generalized well-being, and they can go for it. Some category wise, for example, those people who are middle aged, once everything is good, they can go to the gym. But for example, those who are elderly people, 50 plus or 60, 65 plus, so always it is better to get into the brisk walk instead of, because these category of people, they'll be having joint problems, for example like osteoarthritis, somebody will be having comorbid conditions like hypertension, diabetes and hyperlipidemia, sometimes heart issues also. So these category of population or people, always better to have a brisk exercise.
Just I would like to add some words in this. See, we need to know the exercise part to keep the heart healthy. This is the first thing. The basic question is how we can keep it healthy. Most important thing is what is the recommendation? Recommendation is that you should do at least 150 minutes of brisk exercise or moderate intensity exercise per week, or 75 minutes of vigorous exercise in a week. Now, moderate intensity is a brisk walking, cycling, dancing, gardening. This can be included in that. More important is walking and brisk walking. You should not hit the gym just to run and to make it more muscular body. This is only additive effects, but it is not recommended or it is not mandatory. It is optional. You just can do it to make it little more better health, more early recovery, more health in terms of muscle recovery and the muscle strength. But actually, brisk walking is enough for you. So please, if you do the brisk walking, that will be a very good thing to do. Minimum is the brisk walking, and then you can add on with the gym thing, but it is not mandatory.
So the intense, we do the intense walking or intense gym hitting. So does it going to affect the body of the person, even if it's a mid-age or if a new freshers or the generations coming up, because they are more addictive. I mean, new generation have the influence of getting and hitting the gym just to show up themselves. So does it going to make a difference, like if they have the intense hitting of the gym?
See, the most important thing is if you are starting the exercise, you should get yourself all the number checked. What do you mean by number check? First of all, you should know your blood pressure, your sugar, your cholesterol. You should get a proper checkup before doing any hard work, because what happens once you are exercising, your heart is pumping very fast. It put a loads on your whole body and your blood vessels of the heart also. So doing a vigorous exercise might sometime break your plaques, which is the one reason of your heart attack. So we don't recommend go with a very high exercise. We always say go step ladder pattern. Slowly increase your activity. First you should make sure you make a goal and achieve that goal, and slowly increase your activity. Gymming require a lot of protein supplement. Nowadays steroid drugs, they are absolutely not healthy. They are very bad for heart, kidney, liver. So we don't recommend that thing. This is actually passion, or people are like just running after something. That's the biggest mistake they are doing in their life, and they are suffering. I have many patients who have a lot of bodybuilding type of activity they are doing, but they have heart problems. Some got heart attacks. Unfortunately, some of the relative got sudden death because they never care about the silent features, silent problems. There are so many things which is silently going inside your body which you don't know, because you are only gymming and you just look at one part. You cannot change the genetics. You cannot change the numbers which is inside you, which is bad. That's why we always say, check yourself first. Don't go with the over medications and unnecessary things. Your body require a certain amount of work. Don't do over that, or to if you do over than that, it will be a harm to you. So always guided with some proper trainer and nutritionist and everything, food and everything, that will be a better swim rather than going blind by yourself.
Absolutely. Thank you so much. Moving on to our next audience.
I'll just add one point.
Sure, please.
Yeah.
Go ahead, doctor.
So as you said correctly, anything in excess is always like a poison.
Yes.
So, and at the same time, each person is different. So even identical twins are not the same. So in that matter, we should know that at what extent we need to break, at what extent we need to stop. So after slowly tying into, once we get into the good tolerance, then we can step up the exercise capacity.
100%. Thank you so much, doctor, for your answers and for your engaging words. So moving on to our next audience member, please, you can ask a question.
Good afternoon, doctors. I just wanted to ask you, like, I have the habit of drinking coffee. I'm addicted to coffee, I'll say. So does it affect my heart, coffee or tea?
Okay. So let's see how the coffee goes. See, coffee contains the caffeine. Okay. Coffee is moderation is the word for you. See, 2 to 3 coffees per day is enough, are good for the health. It helps for the diabetes, heart failures. It helps with these things. Tea also contain antioxidants, especially the green tea and the black tea. That is also good for us. It makes our body much better. Now, we have to little bit of precaution in certain peoples. Like especially if you have a high blood pressure or you are suffering from palpitations, especially the fast heart rate, then caffeine intake or the coffee and tea is generally better to avoid. These are not recommended for these peoples. Otherwise, moderation is the word. Go with the 2 to 3 coffee per day. That is enough. But keep checking. Most important thing is you should keep checking your blood pressure, heart rate and everything. So otherwise, no problem.
Doctor, one more question. I've heard vaping is a better option than smoking. Is it?
See, this is a bigger myth nowadays. I would like this to clear with your question. You need to know what is smoking. Smoking contains a lot of tar, lot of harmful chemicals, thousands of harmful chemicals. Vaping is just lighter version of this. It contains little less tar and little less toxic material, but it contains lot of harmful chemicals like formaldehyde, acrolein. They goes inside your body. They make the artery very stiff. They make your blood pressure very high. They make the blockage in your body. So it is almost like equally like a smoking. It's a little lighter version of smoking, but it is same harmful as a smoking. So I would prefer, please, anybody is thinking that smoking, I'm quitting smoking but I'm doing vaping. He is also doing the same calm. He should stop both of things. You can try, if you want to stop smoking, just go with the vaping and then stop. This is the only way we can say you can reduce the things. But it is, I would say, almost equally harmful for your body. Please don't consider that as safe. It is not safe at all.
Good afternoon, doctor. I have a question. How this AI are related? Like how accurate is this? Like for the diagnosis of heart conditions, how we can rely on this AI and how's the accuracy of that?
Yeah.
Can ensure its accuracy?
So I'll just give my idea about that. So the recent studies, we are in the digital world at the moment. So instead of going to the hospital, we can diagnose certain of the conditions. This is what the conception among the general population. So coming to the artificial intelligence, we have so many advancements are there. For example, gadgets or some patches are there. Something like a digital shades are also there nowadays. So much of advancements are there. So in one way, these kind of AI or gadgets that will help in diagnosing certain conditions. But again, the most important thing is this diagnosis has to be confirmed by a specialist or a consent. So that is an important thing. So a person who comes that his heartbeat is somewhere around 130 or 140, which is abnormal, with a digital watch at home, and it is being consulted by the doctor will decide that what exactly is the problem. So sometimes it gives a kind of a wrong signals to the patients. It creates a kind of anxiety and apprehension. So which is, again, it's a problem. So again, whenever you want to use any kind of gadgets, any kind of artificial intelligence or digital world, consult a doctor, take the help, and then you can use it.
I have one more question, doctor. As we age, our heart naturally change. It's a question like what we should expect, how we can.
Yeah, aging is an inevitable process.
Yes.
So we cannot stop the process of aging at any point of time, which is common to everyone. So what happens is, during the aging process, the vessels will lose the elasticity, it becomes stiff, which is the reason for the high blood pressure. Similarly, during the aging process, the pancreas will get slowly aged out and the cells will get slowly starts damaging. So this is the reason for the diabetes. Similar to that, the heart also. So many changes can happen inside the heart. So each and every organ inside our body starts aging process as we grow old and old. So the best thing is get frequent periodical checkups and make sure that where exactly we are standing. Blood pressure, blood sugar, diabetes, cholesterol, or sometimes uric acid and all those stuff. And gradually take the help of the doctors in managing, either by doing a physical activity or by doing a good diet control, or sometimes if it is really required, the medicines.
Little bit of addition. Generally, our heart rate most of the time remains same, but the pacemaker of heart, which we call SA node, which generate the heart rate, it become little more prone for arrhythmias, basically fast heart rate or very slow heart rate. This is one thing. Secondly, as Dr. Srinivasa said, vessels become more stiff, so you have more chance of high blood pressure. Thirdly, your heart become little bit of thick also with age and time, so you may feel more easily tired and it will take long time for you to recover. So that's one of the thing. Secondly, suppose if you have a blood pressure in young age, but as you age, your blood pressure will keep on going high. That is also natural effect. So might be your dose of BP medicine will increase. So these are the expected thing as we age.
Thank you so much. It's really very good information.
Thank you so much. Because so you were like scanning the truth like a diagnostic pro. Okay. I mean, like it was so deep. So I was like just thinking in my mind, like she scanned everything, like the truth, and it's the diagnostic process. So moving on to the next.
Hi, I would like to know what all kinds of food is good for health, and if you strongly recommend one item to avoid, what you will recommend?
Coming to the food or dietary advice or dietary requirements, which is very much important for each and every one of us. Considering the fact that nowadays we are experiencing the heart problems in very young age, in 20, 25s or 30s, early 30s. So the most important, the factor, what the studies have identified is diet, a change of the diet. If you see, there is a lot of consumption of the fast food. For example, the processed food is there. So people, they'll consume a lot of processed food, they consume a lot of junk food, fizzy drinks, there's a lot of increases there. So the best food for the heart to maintain the good heart health is a good increase in the leafy vegetables, number 1. Number 2, the fruits. And number 3, which is very much important, is like whole grains. So this is another important thing which maintains the heart health for a longer period. And the food which has to be avoided is, again, as I said, the processed food or fizzy drinks or eating unhealthy, the junk food, like high calorie items.
Like a lot of time it happens like these days, it's actually, I don't know if it's going in the flow, that everybody I'm meeting one day or the other, they are just having a lot of pains and strains because of the heart. Everybody having a problem these days, and most of the time I'm hearing it out that everybody has passed away because of the cardiac arrest, even though their age is below 40. So what could be the circumstances that can happen?
Well, the reason for all these the heart problems at very young age, as I said, a lot of eating unhealthy foods, number 1. Number 2, a lot of stress factors. Okay. And number 3 is stress along with that reduces sleeping. So we all know that at least 7 to 8 hours of sleep is mandatory for a week. But looking at the picture of the people who are working in 30s or 40s, so they start working for about 10 hours or 12 hours. So hardly they have time to sleep. And these people have, because of the working pattern, because of the lifestyle, they eat fast food, something they can grab something from the supermarket and then eat and then go to the work. So for them, they're at the 20s, 30s, 40s. So at that point of time, the body compensates. The body will not give any kind of troubles. But what all the food they consume, what are all the things, sedentary activities, what they do not do exercise at that particular age will be reflected in the latter part of the life.
So we can say that insomnia is one of the major factors as well.
Exactly. Yeah.
Absolutely. So moving on to the next, we have our next audience member.
Hello sir, I just wanted to know how the people will know whether the symptoms are urgent or they can they can wait for.
When it comes to the heart attacks so the most important thing what everyone knows is the chest pain. So a person who is having a typical heart attack, the chest pain starts as in the left side or in the mid sternum, and sometimes it will radiate to the left hand. So but all the patients may not be having the typical symptoms. Sometimes the patient will be having a little bit of pain in the neck, sometimes he'll be having the pain in the back also. Sometimes simple fatigue or weakness can turn out to be a heart attack. So the typical symptoms and atypical symptoms, here we need to differentiate. A typical symptom who's having chest pain, shortness of breath or sweating or sometimes sudden fall, fainting attacks, all these things are typical symptoms. There we need to rush to the hospital immediately.
So even the cold sweat can also be a symptom, one of the major symptoms, right?
So in the women, atypical symptoms quite nausea, and in the
Yes, absolutely.
slight malaise you're feeling in your.
But sometimes like it happens with a woman all the time. Like they are feeling it, nausea, and they are just going through it, and sometimes they just feel it because of the stress. So does it relate it to the heart as well?
It could be.
It could be for the women, because I think
Incline evaluation is needed.
yeah, because they always have the unstable hormones and they have like a lot of stress more than the men. They are actually having any hormonal imbalance. Does it going to affect the heart of the woman more than a man?
Yeah.
My God.
Especially nowadays because of stress and everything, the premature menopause is also happening.
Yes.
And this time the study says, compared to menopausal women, if the woman goes in premature menopause, the risk of cardiac disease is more than that the old lady of 65 years who is having a timed menopause. So that is also one of the factors. So we need to work on that kind of thing.
So women have like a lot of changes in their bodies.
So they ignore most of the mild symptoms like mild malaise, indigestion. They ignore most of the time.
When this is just the starting stage.
The early signs.
Yeah, the early signs of getting it.
I just add one thing, especially for the women. If you feel it, the symptom is sudden, severe, and strange, which you normally don't expect. So suppose you are doing some amount of activity that is not giving you much trouble, and same amount of activity giving you a lot of trouble. That means it is time to show to doctor. If you have suppose shortness of breath on lying down, minimal exertion, that it is not, you have to check. Also, sometimes atypical symptoms which Madam has said, they are very common in women. Reasoning, the effect of hormones, our body response is different. Their arteries are comparatively small. They have more microvascular disease. So that's why they have more atypical symptom than a normal symptom. Secondly, the woman thinks it's more of a stress and exhaustion and fatigue, but it can be a misleading problem.
Yes, absolutely.
So better sudden, severe and strain, I would say just be checked.
Yeah, so we have to be cautious about that all the time. Thank you so much, doctor, for your answers. So the next audience member would like to ask any
I
questions.
just wanted to ask one more question. How diabetes or increase of blood pressure can hurt heart before symptom shows?
So let's go one by one. So diabetes, we say it's a silent killer. So it keep on in body, at least we study says it is 5 to 6 years, it keep on going slowly, then it become manifest in your symptom. So problem with the diabetes is it more sugar in the blood, you are not, body is not able to utilize your sugar and go to the cells, so it is more in the blood. It makes the different products, and that these products will make more fat deposition in your blood vessels. And it is not only the heart, it is the every part of your body where the fat deposition will be there. So you will have a blockages, you will have a thickening of your heart, you will have a low heart pumping. You will find that other associated disease will be more, like a blood pressure and obesity, fatigue, and all these things will be increased because of that. Blood pressure, people says, I don't know, I have no symptom, but suddenly one day they found your blood pressure is very high. So blood pressure is also a problem where symptoms are very less. Some people may have headache, blurring of visions, especially if it is long standing and very high blood pressure. Sometimes fatigue, sometimes palpitation on exertions. This is some people have this hypertensive related symptom, mostly they don't have. So if blood pressure is high, your heart become thick because it has to work against lot of blood pressure or lot of resistance. Then your heart can become weak. The more chances of blockage in your arteries, and you can have a more valvular disease also. So all the disease of the heart will be increased, and sudden heart attack risk is very high. So this is the problem.
Thank you for having me here, and good afternoon, doctor. My first question is for you. If a woman has an heart problem, congenital, and she's planning to get pregnant, so what are the steps to be taken, and what will be your advice?
Okay. So once the lady has a congenital heart defect, you mean? So first we need to know what kind of the heart defect it is. There's a various range of disease, including minor disease, like small hole in the heart. In simple terms, we say like VHT, AHT, and PDA. Whether we don't need much intervention, so we put on a routine cardiologist screening and routine prenatal care. But when there is a cyanotic heart disease where the lady gets breathless or she is not able to walk without having breathlessness, then we do a multidisciplinary work and we involve our cardiologist team together with us to optimize the outcome before she plans. And we put on some folic acid medications and we counsel how the pregnancy will proceed further. So there will remain the risk also for the fetal heart problem. So we'll have a detailed fetal examination of the baby before the baby born to find out whether there is a cardiac issue in the mother as well or not.
I've got one more question as well, if you allow. Please carry yours. So this is very close to me. So you have hormonal imbalances during pregnancy and during menopause. So there are something like heart palpitations and breathlessness. So I want to know, is it safe during pregnancy and during menopause, or is it a cause for concern?
So see, there's always a range for everything. Mild tachycardia is quite common in pregnancy. When we get pregnant, our heart rate increase from normal. There's a 10 to 15 beat increase a beat in the normal heartbeat range. And the cardiac vasculature had expanded, the volumes increases. So mild breathlessness is common. Sometimes a simple murmur we can also see in the pregnancy, but we have to differentiate whether it's normal or going into the abnormal range. Whenever you are feeling more than whatever you feel, and if you feel uneasy, breathless, more than, then you have to meet your doctors, especially the gynecologist first, and then they will do the routine clinical examination and will put into the loop with the cardiologist whenever required. It's not always the pathology. Sometimes it is also the physiological changes of the pregnancy that affect the heart rate. Okay, so it's important.
During menopause?
So during menopause, there is a hormonal changes as well. Usually after menopause, the estrogen decreases. So it has a positive effect, but by the time we reach to the menopause, we have lots of comorbidities in ourselves. And the body fat also changes in different reasons so that are not good for us. Lipoproteins and hypertension we are always in. So before menopause, after menopause also we need a regular checkup for our cardiac issues.
Okay. Thank you so much, doctor.
So it was not just a rhythm, it's a healthy heartbeat that was going with the flow. So we have the next audience member who would like to ask a question.
Good afternoon, everyone. I want to ask if someone wants to improve or maintain their heart health, are there any important lifestyle changes or any advices you can recommend that people should know or do?
So let's go one by one. First is exercise. Okay, as I told you, 150 minutes of exercise per week or 70 moderate intensity and 75 minutes of vigorous exercise. Let's see, go with the moderate exercise first. If you are cycling less than 10 miles per hour, if you are gardening, if you are playing tennis with doubles, or if you are brisk walking, this is a moderate activity. So you should do at least 150 minutes per day, per week. And then if vigorous activity will come, cycling more than 10 miles per hour, running, doing aerobics, okay, swimming. So this comes into the vigorous activity. And gymming is the hard core gymming. So these are the things. This is exercise. Second thing is food. Most important thing is what we should take for healthy heart, as Dr. Srinivasa said, green leafy vegetables, berries, one of the very good things which contain a lot of antioxidant and very good for the heart. Strawberry, blueberry, everything is very good. Third is whole grain. You can go with the brown rice, quinoa, okay. Then we say avoid the processed meat, smoking, alcohol, and nowadays sugary drinks. They are the very big reason of epidemic of heart problem, diabetes and obesity in young persons like child and the young adults. Nobody is thinking that they are the problem, but they are the very big problem. You should avoid. And also this energy drinks, you should avoid these things. Okay. Thirdly is sleep. As 7 to 8 hours of adequate sleep is very important. You should do your sleeping habit. You should make a habit like you sleep on one particular time and wake up at one particular time. That's give the best result in the long term. Consistency is more important. Then you should have a regular some breathing exercises or some yoga or some meditation as a part to relieve your stress. This is also very important nowadays because the way we are living, it's a very fast world. Everybody is like on the go and everybody has a lot of stress, and this chronic stress is causing all the recent problem of epidemic of metabolic syndrome and whatever you are seeing, early heart attacks and everything. So these are the common reasons. Fifth is you should get yourself checked. That is very important, especially if you feel your symptoms, your mild symptoms are having some shortness of breath, some chest discomfort, some new fatigue, some new dizziness, get it checked. And if you have a family history, please don't ignore it. Don't ignore it. This is very, very important nowadays because genetic reasons are very common where you will get a heart problem in yourself also. So get yourself checked, get a healthy lifestyle, eat healthy, sleep on time, do exercise and meditations. That is the best way to go forward.
I'll just add only one line to the things. What the Dhirender said is absolutely 100% correct. So along with the good physical activity, diet control, as well as good sleep, control the stressful things also. So increase the hydration. So hydration is the most important part because we are living in Middle East. So most of the times we sit in the air-conditioned room because air conditioning here is not a luxury but is a necessity. So 10 glasses of water per day, considering each glass is around 200 to 250 ml, which means 2 to 3 liters of water consumption. Hydration is very much important in order to reduce the heart ailments or diseases.
I just add one more thing. If you want to know how much water you have to drink, if you don't have any heart related or kidney related problem or no other problem, you can just check your weight and make it 40 to 50% of that into the water. Like suppose you have 80 kg, go 3 to 3.5 liter to 4 liter. That would be a rough idea.
Thank you so much, Doctor. Our next audience member would like to ask the question.
Ma'am, I have a question for you. How does a pregnancy affects women's heart? What are the symptoms you shouldn't ignore?
So in pregnancy, as I earlier told us as well, that the cardiovascular volume increase, the pregnancy has that effect because the progesterone increases in the pregnancy. And our body adapt like that our plasma volume increases. So the heart has to work both, not only for the mother, also for the fetus, the circulation and pattern, everything changes. So in routine pregnancy also the heart rate increases, the blood pressure slightly changes. They have different phases of pregnancy which affect differently the blood pressure. Sometimes we get to know that a pregnant lady has hypertensive disease in the pregnancy. That also causes cardiovascular remodeling that affect the long term. Those who have a previous cardiac issue. So depending upon the cardiac status, some conditions maybe even improve with that pregnancy, but most of them get worsened during the pregnancy. Sometimes the only changes can happen only during the pregnancy, like the disease are also related only to the pregnancy and it affects the heart badly, like peripartum cardiomyopathy. So whenever we feel different from the normal, like mild palpitation, mild tachycardia, fatigue is quite common in pregnancy. But if you feel it more than what you are feeling in a normal regular pregnancy, or you are feeling your pulse rate by yourself, meet your gynecologist and ask them to check for the blood pressure and the cardiac screening, even the cardiac examination, clinical examination. And if they find anything, maybe they advise further for the ECG, echo, even in the pregnancy. Especially in twins and those who are having hypertensive cardiac disease, or those who have previous cardiac disease, have more risk for having cardiac problem in advanced age, and it manifests most of the times at the time of delivery on the third trimester, and even at the after delivery, immediately after delivery. So these are very critical period for worsening of the cardiac condition.
I have a question. See, in movies and all, we see, you catch your heart and you get heart attack or something like that. So are that is the only symptom? What are the other symptoms we usually miss? Because we see movies and we think that is the only symptom. So please.
We all know typical heart attack like symptom. Have you ever seen in the movie one of the person is keeping hand here and is falling down? Okay, so that is the typical movie heart attack. Okay, in real life also you will find this thing. We always know that it's a chest related symptom, the pain come to the chest, but it is not always correct. Sometimes some different symptoms also comes. Like you can have only pain in the neck, jaw or throat. You can have pain in the arms only. You can pain in the back only. Sometimes you feel some acidity, regurgitation or indigestion. Sometimes nausea, dizziness, lightheadedness or cold sweat. This is also there. If you feel like sometimes they feel like something is wrong, but they can't explain the things. So that is like indirect symptoms or like warning symptoms. So atypical symptoms are more common in women, diabetic and elderly. And sometimes, especially in diabetes, you don't have any symptom also. They have silent heart attack also because the nerves which carrying the pain sensation already damaged because of diabetes. So but by only getting to know the ECGs and other tests, we get to know these problem are there. So atypical symptoms we should always look for. As I always say, something which is not common every day and it is getting new, please get it checked.
Thank you so much. Anybody wants to add something?
Just add very common symptoms. As you said, chest pain, yes. Everyone will say that you go and check your cardiologist and check your heart status. But nowadays we can see, a lot of patients are coming with indigestion, simple indigestion, something like a burping, or sometimes they feel like some burning in the heart. So routinely these symptoms has been ignored by the general physician or sometimes a pharmacist also, saying that this can be acidity, just take this pantoprazole. But these symptoms, out of 100 patients, suppose if we miss one patient thinking that it is a gastric issues, so we'll be losing that. So never ignore any patient who is complaining that indigestion. Get a simple ECG, which is a non-invasive thing, and get a basic cardiac workup done. So that saves definitely a significant life.
So congratulations, you earned the honorary badge in cardiologist, because that was an impactful question. I mean, like, it came out of the blue, but definitely makes a lively session for us. So moving on to the next audience member.
I have another question, doctors. I want to know if anxiety and mental health really affects heart health. If they do, what are the effective how you manage it to good health, good heart health?
Yeah, well, if I understand your question exactly, the anxiety issues, how it is impacting very good question it is, especially the relevance in post-COVID era. So heart is being influenced by various factors. Yes, as I said, physical activity, the diet control, as well as the stress. So if you see the heart rate, the normal heart rate is 60 to 90 per minute. Anything above 90 is considered as a high heart rate. So whenever the heart rate becomes increased, the heart will be pumping more and more. That creates a kind of stress. So the factors which led to the high heart rate, whether it is a medicine, so whether it is something like blood pressure, or sometimes even the kind of stress what we are taking, is also can impact the heart health. So now there are various studies which have been conducted post-COVID. So in post-COVID, the anxiety or the tension levels have increased significantly. So because COVID pandemic is not a simple pandemic, if millions of patients have been they expired. Okay. So because of that fear, a lot of patients, they tend to have a kind of anxiety. Or some patients who already got vaccinated, or some patients they're already taking some medicines, they have increased the stress levels as well as the heart rate. So heart rate is also an important role in order to reduce the heart elements or heart attacks.
A little bit Eddie from see, anxiety, what basically it does to you, it is a fight and flight response. So it increases your cortisol level, that is a steroid level, and adrenaline level. So these things what will do, they will increase your heart rate, they will constrict your blood vessel, make the blood pressure high. If all this stress is going, there is a possibility that some little bit of disease which is going on your heart, it will rupture the plaque and convert into a heart attack. Nowadays, everybody is like chronic stress. You will see everybody is in chronic stress. So your heart is at stress from a long time. So it is taking all the stress throughout so many days of your lifestyle, lack of sleep and office stress, home stress, everything. Ultimately, you are finding that you are getting high blood pressure, your sugar is high, you have a heart-related troubles, you have a heart attack, you can have a stroke also, you have a chronic fatigue also. So all these are things which are leading to the problem because of anxiety. I have many patients where I find there is no other risk factor. He's a young chap or young persons, less than 40s, even 30s. I have one female in 20s also. She got a heart attack. Female 20, we never heard, but I have one patient. Then what is the reason? Their cholesterol is normal, their blood pressure is okay, their no family history. When I went, what is your lifestyle? They told me that they work continuously long hours, sitting job, sedentary lifestyle, not taking enough good food, mostly outside food, and they have habit of sitting and couching, just watching TV and high intensity games, video games and screen times. So all these things are there, but we find that the main reason of this is stress, which we like ignoring nowadays. See, sleep has come as a big factor in risk factor for the heart. Now it's a major risk factor. Earlier we never considered it as a major, but now it's an established major risk factor. Now stress is also the same. So please, stress is the most important part of life. We have to deal with it. We should know how to correct it, maybe with breathing, exercise, yoga, meditation, get a social circle, talk with your friends. These do some activity, choose your hobbies and just go with it. So these are the things which will make much better.
So I also have one question. Like, people love to have swimming like all the time. They go and they will be swimming. Like in Middle East we are living and we always feeling to go and have something like swimming, because we also consider it as an exercise. So do you think that regular swimming will going to impact the efficiency of the heart?
Swimming is actually very good exercise. I would prefer, if you don't have any heart related problem or you are a normal healthy adult, swimming is a very good exercise for you. We want you, always say, if you cannot do other things, suppose some people have joint problems. Yes. They cannot do exercise, they can't run on a treadmill. So we say just go with the static cycling or go swimming. So swimming is, we say, one of the best exercise. It is good for your muscles health, good for your overall cardiovascular health. So swimming is actually a very good exercise.
So that can be on a regular basis. We
absolutely
can consider it.
Yes, you should consider.
Thank you, doctor.
Yeah. I'll put it in this way. Yeah. Swimming is the only exercise which involves all the muscles inside the body. For example, if you do the cardio, then where your heart rate will increase, your legs will, whereas there won't be much movement of the hands. But in swimming, the whole
body is active.
The whole body, it is considered as a mix of aerobic plus anaerobic.
Absolutely.
Yeah, it is the best exercises.
Yes.
Provided there won't be any heart issues.
Coming back to the same thing, like I have an additional question to it. Aerobics and Zumba, most of the people prefer to go for that rather than going to the gym and hitting the gym all the time. So do you think that it could be a part of our daily life if you want to go and consider aerobics and Zumba to include it in our lifestyle? Does it going to make an impact for it?
Yes, you should include it. Ideally, you should include it. Aerobic exercising, Zumba, actually it's for a high intensity training, we say sometimes. So this is very good part. We say this is comes into the vigorous exercise. So 75 minutes per week is allowed.
It's actually allowed.
Yes, it is actually allowed. So better you should do it. It's a really good exercise.
Thank you so much, doctor, for the answers. Moving on to the next, we have our next on.
Okay. I wish to know the coolest and the newest gadget and technologies doctors are using to take care of hearts these days.
So I will answer this thing. Normally in our day-to-day cleaning practice, what we are doing baseline ECG, echo, CT scan with a CT calcium score or a CT coronary angiogram. Other than this, what we are doing, we have certain patches and certain devices we put to the patient and let them go home. These devices are just attached to your chest, and some devices are so small that you can see it's like this much size only. Just put it and go home. And they can replace it, then can remove it and again put it. Even for 2 weeks and 4 weeks also. These devices are like giving a continuous health data. ECGs, particular rhythm related issues, heart rate variabilities. These all things are giving continuous data to us. Secondly, we have nowadays more refined things are coming. You will find that some patches are of the gadgets, especially nowadays. You know, also fitness watches and fitness rings, they have come. They are also checking your heart rate variabilities. Some, but we recommend because they are for lifestyle purpose and the health purpose. For monitoring purpose, where we think really serious disease, we have certain cardiomobile and cardiac sense. They are the things which give us proper ECG and proper blood pressure and saturation of the patients. So they are the newest gadgets. Certain things are in the pipeline also. Now some saliva which can detect your heart enzymes. So the test, some certain tests are coming. They are in process of clinical validation. So things are coming more and more. I think with the time you will find that it is more commonly incorporated. Every person or other person will be using it over a period of time.
Thanks.
Okay, thank you, doctor. One more question. With all these smart rings and watches, how will I be able to pick which one is legit?
The answer to this is, first you define why you want it. You want just to track your health, that is called lifestyle. Then you can go with a normal, many brands are coming. I just can't give you the name, but these are only track your heart rate variabilities and the trend. How's your heart rate was earlier day, how's today, how's your recovery, how's your sleep, these things. This is basically for lifestyle and this lifestyle problem, to see the lifestyle things. Now for us, we get little more, if you want a continuous ECG, suppose you have a palpitation, you are sitting at work, you suddenly want to see what happened to me. Now the Apple watches, Samsung watches, they have a ECG, just connect it and all the ECG will be recorded in your phone, and that you can show to us while clinic visit. So these are the things. In addition to this, as I told you, medical grade devices, cardio, as I showed you, cardio mobile and cardiac sense, they are very highly regulated one and given by the medical authority, they have approved by them. So these are the things which we prefer in our clinical practices. But other things, the other rings, other gadgets, I would say they provide early warning symptoms. They are used as early warning symptoms, but doctors are the one who see, analyze, look at your symptom, look at your physical finding, and then connect the dot.
Okay. Lastly, can these wearables or this gadget, can they replace my routine checkup with cardiologist?
No, they never can replace your doctors or a routine checkup. See, gadgets only give certain data. They don't know what symptom you are having, why your shortness of breath is because of heart problem or you are not exercising. They just give you certain symptoms, that your heart rate is high or low. They will give you the trend only. They don't give you physical examination findings, how your heart actually is, how your heart pumping, ECG, echo, what exactly is the problem with you, they can't give you. So going to the doctor is very must. That you can say these gadgets are co-pilot and the doctor is the head coach, or you can say co-coach or main pilot.
So they are the pilot who are taking as a pilot. Yeah. So there is one question which I just gone through your answers and I just got it in my mind. It just hit it actually. So how does a person comes to know that their heart is healthy actually? If they are not visiting the doctors more oftenly, so sometimes if they want to know, how does it going to be rectified or how they can see?
See, suppose you are healthy and you think, why I need all these things. So you should, as I told you, you see everyday disease are in nearby neighborhood and everybody is having. First you go to a doctor to check up. First you ask yourself, lifestyle, what I am eating, how I am sleeping, what's my family history, or I am having some borderline, my numbers of sugar, cholesterol is high and all these things. Is I am feeling new symptom, any new shortness of breath, any new fatigue which earlier I don't used to feel. Still if you don't have any of these things, still we say please check your heart, because examining at 40 is like we are preparing for next 40 or more. So what we do, we check all the parameters, lab parameters, to look for your risk factor, sugar, cholesterol, blood pressure, and everything we look at. Then we look your ECG, and then we define with the risk profile how much 10-year risk of heart problem you have or you can have. Then depending upon that, we can go with the higher test like echo. Echo is like ultrasound of heart. That will give me the answer how's your heart function, how's the valve status, how the thickness of your heart, how the lung pressure. Then we go for the treadmill test also, where it is required. And in the treadmill test, we try to make your heart exercise on the treadmill and see the ECG. And we try to see any changes in the ECG when a particular heart rate is reached. So we look for certain changes. If these changes are there, then this gives us indication that there might be some wrong with your heart. So then we get one step higher, and then we try to check either with a depending upon your risk and the ECG changes, CT scan or a normal angiography. Then this is the next step.
So the next step. Thank you so much, doctor. Anybody wants to ask the questions, please.
What is the relationship between cardiovascular health and cholesterol? Like, what is the relationship?
It's a very good question. So the relation between the cholesterol and heart health, cardiovascular health. So as we all know that the cholesterol is two different types. One is good cholesterol, is bad cholesterol. So when it is a bad cholesterol, for example, total cholesterol and HDL or even triglycerides also, so that directly it affects the heart. How it affects the heart? Whenever the blood levels of cholesterol increases, this cholesterol will go here and there and it will get deposited in the heart vessels. This deposition of cholesterol later on it will turn into plaques. When there is a plaque is deposited in the heart vessel, there is blood circulation will be significantly decreases. So this is the reason that we are getting the heart attacks. So high cholesterol, it has a direct impact upon the heart attacks. So it is our responsibility, our duty to reduce the cholesterol by eating healthy, by doing the good physical activity. And periodic checkups. There are two different types. The cholesterol what we get from the food and the cholesterol what we get it from the genetics. Sometimes something called familial hypercholesterolemia, where our parents or grandparents, they'll be having a high cholesterol which they'll give it as a gift. So this cholesterol has to be controlled by again the good diet control and exercise, which is a physical activity of 150 minutes per week. And the third thing is medications if it is required.
Thank you so much, doctor. 1,000 million question.
Hi, I have another question. So right now I'm at the age of 40, and I don't have any symptoms of heart attack and stuff like that. So do I need to do regular checkups? Because people say after 40 you do regular health checkup for heart. So what is the actual age for doing it? And age is just a number is what people say. So please enlighten me.
We say that after 40 you should check first. If you are absolutely healthy, no risk factor, no family history, nothing. But nowadays, what you find that the disease is so common, as I told you, 20s, 30s and 40s, the disease is so common, we were getting heart problems so early. So just try to see what are the problems you are facing or what are the risk factor you have, what are the silent things going on inside you, because you should know your number. I always say you should know your number. So that if you know your cholesterol, you know your blood pressure, your sugar, so that gives a starting line. You can work on it. So, if you have a family history, if you feel new symptom, especially it is not earlier present, shortness of breath, fatigue, tiredness, chest discomfort, hand. So this is a new symptoms. Cardiac family history. Your lifestyle is very sedentary. Your weight is more. You feel very frequent fatigue, and your eating habits are mostly from outside food. Then you get it checked early also. Okay, so it's not certain age is not defined. Earlier we used to say 40 plus, but now this line is blurring. Get it early, and I always says to my patient, at least keep one day for your whole body. Please check one day in a year for whole body. Please do all the tests which is required for your body. That is very, very important, which we are never giving one day. We are always ignoring, who will go to the hospital, who will do all this thing. But please give, if out of 365 days, please give 1 day for your whole body, get yourself checked. This is very important. I think you should go.
Actually, I have a follow-up question. So, what is the test we need to take? So, we say only go take ECG, but is it the only test we need to take? What are the this follow-up question?
The ECG is the basic test. You need to know what is ECG. Just give the electrical activity of the heart. It will tell you had earlier heart attack, you are going through heart attack, or any chamber dilatation of your heart, any previous problems, your rhythm problems, your irregularity of parts. So this gives the only electrical activity. But we need to do other test also, like echo. As I told you, echocardiogram, this ultrasound, to know the exact heart health. How your heart is pumping, how well it is pumping. Then as I told you, depending upon your risk factor and certain symptoms and your risk profile, we then do the treadmill test also. And even with the certain risk profile, we go for the CT calcium score also in a healthy young person. We look certain amount of calcium score. If certain calcium score is high, that means you have a high chance of heart blockage in the future. So get it done that also. So these are the basic tests which you, if you want to know your heart health, you can do.
Thank you so much, doctor. Anybody wants to add anything on that? Would you like to add any element, or you want to give any of your impactful answer to it?
Yeah, as Dr. Dhirender said, he mentioned very well. The three most important things which I would say to all my patients is three things. Number one is diet. Number two is the physical activity. And then number three is whether they are checking periodically the checkups, heart checkups. So diet, we all should know that whether what we are eating is correct or not, including the hydration. And number two, exercise, physical activity. Whether we are doing good amount of physical activity with a good sleep, that is two. And number three, when it is really important, as he said, there is no age limit for the checkups. Checkups can be done even at the age of 20, 25, or it can be done at 40s or 50s, depending upon the requirement. So once we do all these three things, then we can make sure that up to a certain extent we are healthy.
And one thing I will like to add. See, I just tell you today's news. In Odisha, the government have done certain survey. In government schools, they just almost like very large number of people's children, like 6 months to 18 years of age. They checked for the risk factor, what are the normal risk factor. You will be surprised, in 6 months to 18 years of age, out of like 1 crore population, they have checked 7.3 lakh children have a high blood pressure. Nobody is thinking like children can have up to 18 years of age can have a high blood pressure. So this is now it is becoming more common, which we like you have to do it early. You can't skip it, the age factor, that I will be 40, then I will do it. No, you get it done now. The silent epidemics are coming. We have to be well prepared ahead.
Yeah. Just like prevention is better than cure. Yeah, absolutely. I mean, less of shoppings and more of physical activities we need it now. Okay, moving to our next audience member, if anybody wants to ask the question.
It's kind of a common question nowadays. So we used to listen, heart attack is for old people, but now the younger generation between 18, 21 while playing, people are like sudden heart attack getting. So what is the reason and what is the solution for that?
See, this is one of the myths, that older gets the heart disease, younger doesn't get the heart disease. Second myth is woman doesn't get the heart problem. This is a second thing. Or they have a less chances. This is also a myth. Problem is your lifestyle. If you look at the younger generation, what they are doing, they are working long hours. They are awake very long time. They don't sleep on time. They are eating outside food, unhealthy foods. They are not eating any healthy foods, green leafy vegetables, berries, and they are not eating this thing. They have a lot of stress of office, home. They want to complete their work on time. So they are going through lot of stress, and they are sitting most of the time. So they are not going outside, hitting the park or the gym. So problem is, let's start with this lifestyle. Our lifestyle has become very bad. So this is giving the bigger problem. Secondly, silent risk factor, which we are not checking in youngs, as I told you. That's why I always again saying check your number. We are not checking blood pressure, we are not checking cholesterol, we are not checking other parameters which is required for you. Sometimes we check for the ankle brachial index or the obesity for waist circumference. So many things we are not checking, silent things. Thirdly, they ignore the family history. Certain genetic diseases are more common if your father, mother has got a problem or your sister has got a problem in young age. So you are also very high chances of getting a heart problem. This is third, we are we are not taking it seriously. Okay. And fourthly, certain subtle symptoms of sign sometimes your body are giving, which you are ignoring. Fatigue, shortness of breath, lightheadedness, dizziness, body discomfort. So you are not giving much importance to that because you are busy in your life. So these things are, and suddenly you start hitting the gym. The body is not used to that. You want to make a muscle in 1 month, 2 month, 3 month time. So your body is not acclimatized to this, and you are making more efforts to do the desired result. So at that time your body is at peak stress, which he is not normally used to be in stress, but you are hitting engine, so it's getting a peak stress. Peak stress produces the very high chances of plaque rupture in your heart, and they are getting heart attack suddenly. That's why they are running on a treadmill and suddenly got a heart attack and they collapse there. So that's why they are reasoning. So these are the common reasons why we are getting the heart attack in common young people.
I hope you've got your answer that women don't get heart attack, they actually get the heartbreak. So basically now you have said one thing that we definitely need to, I have also seen that the generation which is coming up, they are also doing the same process, hitting the gym intensively, and they just want to build up their bodies and muscles, which is they cannot cover it up, and they have a overpower to it. So does it going to impact their lifestyle also? Most of the time we have heard about the intermittent fastings. The windows are open for so and so time and they are not having the breakfast, they are skipping the breakfast, they are only bothered about the lunch or the dinner. Does it going to make any difference to the heart, or it's going to affect them?
So yes, whether it comes to the intermittent fasting or whether it comes to the intense gym, ultimately what we should understand is each body is different. So whether this intermittent fasting or just one meal per day, which is even worse than that, so does it suit to the body or not? So our body will not get used to it or accustomed to it overnight. It needs a lot of exercise for, let's say, for months together, and it needs to understand. So body should get used to it. So there are people who can reduce the weight with intermittent fasting, but everything should be done with the help of the dietitian or nutritionist. So again, when it comes to the intermittent fasting, so intermittent fasting, it releases a lot of hormones incident as well as a lot of stress related impact will be in there. So it's really difficult to say that intermittent fasting will help each and everyone in the world. No, it has to be individualized.
So it also shows us the lack of nutrients, and
yes,
it's going to make an affect our body organs and the parts also, because I think a lot of people are relying on these days intermittent fasting will going to help them out to sort their body issues, but in certain ways I think it's going to be more complicated.
Yeah. See, I will add little bit. Have you heard Shane Warne? He was on a liquid diet. Okay, many young people who have lost in 2 months, 3 months, they have lost significant weight. They are the one who sometimes die also.
Yes.
You recently, one newspaper you have seen, because they are doing it out of proportion of their requirement. They are going very fast with the way they are doing. It has to be properly by a certain doctor or a nutritionist or dietitian. They should guide that we should lose this much weight in this much time. People say more weight loss, more better. But it is not like this. It has to be very regulated, very slowly, and because if you go slow, you will last longer. If you go fast, you will find after 3 months, 4 months that they are not able to continue this thing because they are not used to this thing. So already then they get you will find their weight again will increase because they have stopped it.
Yeah.
So slower is a better rather than going fast, and get a individualized approach. The person with obesity have a different requirement. A person with a little sedentary has a different requirement. comparatively you're working has a different requirement, so it has to be like individualized.
So the intermittent fasting is not only the thing, but we have to be proportionate about the food and everything what we are eating in our daily life. Thank you so much, doctor.
Yeah, I'll just add before that regarding the keto diet.
Yes, the keto diet.
So everyone must be aware of the keto diet. So keto diet is exactly what exactly it is. So cutting down the carbohydrates completely, like rice or whatever it is, in carbs completely, just consuming the oily things, the fat items. They used to consume somewhere around three full cups of coconut oil, virgin coconut oil. What they said is organic coconut oil. So I have a patient who wants to do the keto diet. So despite of the best medical advice, he said, I'll go ahead with the keto diet. So what we have done is, we have checked all his parameters, so-called the numbers, the blood pressure, sugar, cholesterol, uric acid, so on and so forth. And he has done the keto diet for about 4 months, and he came. Trust me, his numbers are tripled. His cholesterol jumped, and his sugar has increased, his uric acid has increased. So anything which is not suitable to the body,
it should not be consumed actually. So I think this is just, we are coming to an end right now, and we have reached to the end. So thank you so much. It was an incredible, insightful health cafe session in cardio health. So it's been a fantastic journey, ladies and gentlemen, exploring everything from deep dive into jumping from one source to another, just not for the transformations, but also to get a lot of new things that we have come up with. So thank you so much for insightful session today. Thank you so much to all the doctors. A massive thank you to our brilliant doctors, Dr. Dhirender Singh, Dr. Srinivasa Rao, Dr. Gazala, Shahnaz. Thank you so much, and thank you to our wonderful audience. Thank you for engaging questions, for asking so many questions, and literally it was incomplete without you all. Thank you so much. Remember, your heart is a marathon, not a sprint. The small steps you take today will definitely going to lead you to a bigger visions. Thank you so much.